Dr. Drew Locandro here today to discuss ear surgery. The ear surgery we're about to discuss is called a tympanoplasty with mastoidectomy. Another word for that procedure would be tympanomastoidectomy. Generally, this ear surgery is done for chronic ear problems. They include ears with holes that drain for long periods of time. They include a problem with a cyst of the ear, which is called a cholesteatoma. This procedure can also be done for long-standing hearing loss. The procedure is done as an outpatient. It does require general anesthesia. It takes approximately 1.5 hours. Recovery is relatively quick. There is minimal amount of pain. Most patients do very well with Motrin or Tylenol. You will be prescribed a prescription pain medicine as well as medication for nausea for use as needed. From this procedure as an outpatient, you will wake up with a headband around the head, which is a Velcro strap holding on a small plastic cup covering the ear that had the surgery. Your surgeon or the staff will instruct you on how to manage this ear bandage and when to remove it. Once the bandage is removed, showering with soap is advised. There is an incision behind the ear with sutures. These can be washed and cleaned with plain soap and water. We do recommend cotton with Vaseline placed right in the ear canal to prevent water from going down into the ear canal itself. However, as I mentioned, one can use shampoo and soap around the back of the ear as needed. We typically see patients 1 week after surgery, planning on removing the sutures. However, we really don't check for hearing until approximately 6 weeks later because there is a relatively long healing time that needs to occur from this type of procedure. This procedure involves an incision behind the ear where the surgeon can fully access and see the eardrum, all the structures behind the ear, as well as working into a bone area behind that region called the mastoid bone. Usually the eardrum is repaired with a fascial graft, and occasionally we use implants as necessary. Generally, the results are very good, 80 to 90% success rate. However, like any surgery, we cannot guarantee success. There are some risks, particularly to this procedure. They include persistent infection and bleeding. There are several nerves in the area that we carefully try to avoid. However, in rare cases, that is 1% or less, one can experience decreased nerve hearing level, which may be temporary or permanent. Also include persistent ringing of the ear, as well as weakness of the motion of one side of the face, as well as change in taste.
This video is presented for general information purposes only. No attempt is made to include all significant risks and benefits of surgical procedure and may not apply to a particular patient. Review with your physician any questions before signing the informed consent form.